Well, if you've ever had a migraine, you know it's absolutely awful, and it can completely put you out of commission for an entire day sometimes. And there's a new study that shows there's a heavy toll on not only the person who's dealing with the migraine, but it also impacts much more: family activities, parenting responsibilities, relationships, and even finances. Dr. Brian Grosberg is joining me to talk all about it. He's the director of the Hartford Healthcare Headache Program. Doctor, thanks so much for being with us.
Thank you for having me.
All right, now we were talking in the break. I just want to sort of go over first. Everybody has had a headache.
Yes.
But when do we know when it's crossed over into that migraine status? And then how bad does it have to get before you go to the doctor, you go to the hospital?
Well, migraine isn't just a headache. It's a neurologic condition. So people often have pain, but they'll also have other symptoms with it: light sensitivity, sound sensitivity, maybe some nausea. And so very often that migraine can be more debilitating than, quote, just a headache. In cases like that, these are headaches that are usually recurrent, so people will experience them infrequently or frequently, and so we have people keep a diary or a log to keep track of those headaches.
Right.
Sometimes they need over-the-counter medications, and sometimes they need prescription medications to help treat them appropriately.
And in some cases, people actually have to go to the ER because they have a migraine that's just so bad and it won't go away.
That does happen, and not infrequently, but very often we try to tailor treatments so that they don't need to go to the emergency room.
Right.
So that's why it's important for them to speak to their health care provider or even see a neurologist or a headache specialist like myself to prevent that from happening.
Talk about the impact. The study that was recently done that shows the effect of migraines goes well beyond just the person who's dealing with it.
Right. So this was a study that was done that looked at migraine sufferers and their families and the impact that it had on personal relationships, family parenting, as well as financial concerns. They looked at over 4,000 couples, and more than half of those were people who had children. And what they noticed is that it had an impact not only on people who suffer from migraine, but their families. And so it has, what we hear from patients when we see them at our headache program, and academic headache program, as well as other programs across the country, is that migraine impacts more than just the person. So parenting responsibilities, financial concerns, and overall a quality of life.
Yeah, I was talking to you. I'm dealing with some of that with my son. He's got a lot of headaches, and we're trying to figure out if they're even migraines.
Sure.
And it changes the entire day, the entire afternoon. If he's coming home and he's really feeling awful, he has to, go to a dark room. And the end of the night, that's it.
Yeah, people don't
Can't
realize
go
that that children could end up suffering from migraine as well. And so usually we'll work with the pediatricians or adolescent physicians to let them know that migraine can end up affecting kids.
Yeah. Now, speaking about treatments, you have a very unique and innovative program at Hartford Healthcare, specifically for people who are dealing with migraines on a regular basis.
Yeah. So this program is one of a few only in the country.
Yeah.
And so what we're looking at is providing multidisciplinary headache care. So what that means is full scale, not just looking at headache, but the whole person, using non-medication medication approaches to ultimately improve their headaches, their quality of life and functioning, get them back to work and not only impact them, but also their loved ones.
Yeah, and talk a little bit about the therapy that you're doing there.
Sure,
there are some new medications.
Yeah, so there are different types of treatments, both medication and non-medication approaches. So for medication approaches, things that are looked at in the pipeline, so things that haven't come to the market yet. Some devices like transcranial magnetic stimulation, which uses pulses of magnetic energy to abort a migraine. Infusion treatments, which is available only in a few places in the country to help rapidly abort a headache, to try to keep people out of the emergency room.
Really?
Yeah.
Okay. Now we have to imagine a lot of this is prevention. You were talking about keeping a diary, which we have tried to do at home as well, a headache diary, because you want to look at what's happening before the headache comes on, right?
Yes. So
what are some common triggers?
So triggers are not the cause of the headache. They can help bring on a headache in someone who's already predisposed to having a headache. And usually it's a combination of two or more triggers. An example of that would be, inclement weather, rainy weather, and the person didn't get enough sleep. So the combination of two is enough to reduce the threshold for somebody to experience a migraine. So what the diary does, or women get a diary, men get a log, it sounds more masculine. So what the diary or log do is it actually keeps track of frequency, but also for woman, it may be her menstrual period, where many women will notice that there's a relationship between their headaches and their menstrual period. And by keeping track of that, what that does is it actually empowers patients. It lets them know, kind of take a more proactive role rather than reactive.
And you were telling me some ages and also some sexes might tend to experience migraines more frequently than others. You were just talking about pre-puberty. Boys experience migraines more than girls.
That's correct. Yeah.
And is there any other sort of comparison between men and women?
Well, after puberty, what ends up happening is then the curve separates, where women experience migraine 3 times more often than men. Yeah, one of the reasons is hormonal, but there are other reasons as well.
Yeah. All right, doctor, thanks so much. I really appreciate your time.
Thank you so much.
And we're going to have the information on the program at Hartford Healthcare on our website. Just go to fox61.com to get all that info. Once again, doctor, thanks.
Thank you.
Stay with us.